Hello dear student. Today we are going to discuss about a new topic that is called glaucoma. In previous classes I have already finished up different drug acting on autonomic nervous system, in which includes sympathomimetic drugs, sympatholytic drugs, parasympathomimetic drugs and parasympatholytic drugs, according to which how they act on ANS and specifically onto the parasympathetic nervous system and sympathetic nervous system. According to that four class type of classification of drugs we have already studied into the previous classes. During studying of that four type of drugs, sympathomimetic, sympatholytic, parasympathomimetic and parasympatholytics, two terms that we used most oftenly in that old four chapters were one glaucoma and another more word or condition that we used mostly in all that four classification of drug, that was myasthenia gravis. So that two words we have used in that classes very oftenly. So today in this class we'll going to discuss about what is the meaning of glaucoma, where we are using that frequently in that four chapters, and what is myasthenia gravis into the next class. So today's topic is glaucoma. So glaucoma is a condition, or you can tell disorder condition. We all know disorder condition means in a organ when it is not showing its proper action, or it is unable to show its action or do their function as specified their function, that condition is called a disease condition. In that time that specific organ was unable to produce their specific function for that which is intended for. That glaucoma is same like of disorder or condition of eye. So glaucoma is a condition when our eye cannot function it according to its own potential. So what is this condition, why it will takes place, what is the reason of glaucoma, that we are going to discuss into this class. So glaucoma is a disorder condition of eye where the intraocular pressure increases due to the damage or in specific trauma on optic nerves. We know the nerves which is generally connected from our eye to head or eye to brain, which generally control the action of vision or function of vision, that is called optic nerve, that is related to our vision, which is directly connected to our brain with the eyes. So in this glaucoma condition, what it will happen, due to the trauma or damage in optic nerve, that is directly affect the vision function of eye, for which, for that trauma on optic nerve, the intraocular pressure on eye, it will be increasing than the normal one. The normal value of intraocular pressure is 16 to 23. When that value generally increases due to the trauma, damage or any other causes in optic nerve, it causes damage in optic nerve, and damage in optic nerve directly affect the eye, and we know if the eye is affected, then that eye will not do their function which is vision, so it will cause problem in vision. So what is glaucoma? Glaucoma is a condition where the eye started to show less work or less function due to the increasing intraocular pressure of eye because of the damage, trauma or any other reason which generally damage the optic nerve, and the damage of optic nerve directly affected the vision function of eye. This condition of eye where the vision got affected, that is called as glaucoma. That glaucoma will leads to the increasing of intraocular pressure, and that increasing of intraocular pressure will causes progressive and permanent vision loss. So due to the inefficient work of optic nerve or damage in the optic nerve, that eye generally become unable to produce proper vision or proper vision function to our brain, which will cause the increasing in intraocular pressure, damage in ocular nerve, that will leads to the progressive and then the permanent vision loss. And that glaucoma generally showed into the person whose age is generally more than 40 years. So that glaucoma is generally showed to the patients whose age is more than 40 years, and sometimes it also can take place into the infants and juvenile. According to that, different types of glaucoma is there. The classification or type of glaucoma I am going to discuss into the next slide. So we will discuss now what are the etiology of glaucoma. Etiology means reason. That means the different reason for which that glaucoma generally take place, or that condition is shown into the person who are generally more than aged of 40 years, and sometimes it also shown under infantile under 10 years. That we are going to discuss when we are going to discuss about the type of glaucoma. So what are the etiology or what are the reason of glaucoma? First one is increase in intraocular pressure. I have already told you in normal eye the intraocular pressure or IO is 16 to 23. That means when glaucoma is taking place, the intraocular pressure go beyond 23. That causes damage in optic nerve, that leads to optic nerve dystrophy. So due to the optic nerve dystrophy, that intraocular pressure of eye getting higher than more than 23 unit, that leads to the improper vision of eye, that leads to glaucoma. Due to that glaucoma, it can cause permanent progressive vision loss. Some condition or risk factors are there. When a person is affected by all that risk factor, that pupil generally easily can be affected by the glaucoma. Now we are going to discuss about all those risk factors that can lead to glaucoma. So risk factor: a person or who generally can be affected easily by glaucoma. If this type of risk factor is shown into a person, then that person will easily getting affected by the glaucoma. So what are that risk factor that I am going to discuss now? First is age. I have already told you, less than 10 years old or especially more than 40 years old people generally easily affected by glaucoma. Then trauma or damage in eye during surgery, or in any case, or sometime due to the damage in optic nerve, that person can easily getting affected by glaucoma. If one person is suffered from diabetes mellitus, then also a transparent or opaque white color will going to grow on the black spot of our eye, that leads to the whiteness of eye, and that whiteness of eye leads to cataract, which we generally told vision loss. That vision loss also generally caused by person who have diabetes mellitus. So it is also a risk factor. When a person is affected by diabetes mellitus, he can be affected by glaucoma very easily. And the person who generally suffered from migraine headache, that person also can get affected by glaucoma. And the person who is using corticosteroids for some disease treatment or for any reason, if he is taking corticosteroids drugs or corticosteroids foods for a prolonged period of time, then the person also can be get affected by the glaucoma. Then which are the effect or factor that can cause glaucoma in person? When a person age is more than 40 years, when the person is suffering from diabetes mellitus, when that patient is feeling migraine headache regular basis in daily life, when a person is taking corticosteroid for a prolonged period of time for treating disease or for any reason, that also can cause or leads to the glaucoma. All these are the risk factors by which the person can be affected by the glaucoma. Now we will discuss about the different type of glaucoma. Now we are going to discuss about the different type of glaucoma. That glaucoma is classified into the two types of glaucoma. Now we are going to discuss about different type of glaucoma. So glaucoma is classified into the two types. First one is continental, congenital. Now we are going to discuss about different type of glaucoma. That glaucoma can be classified into two type. One is congenital glaucoma and second one is acquired glaucoma. That can be further classified into two types or two subtypes. In congenital glaucoma, it can be classified into two parts. One is juvenile. That type of glaucoma generally showed into the child whose age is less than 13 years. That type of glaucoma is called as juvenile glaucoma, that comes under congenital. Another one classification is infantile. That is glaucoma, one type of glaucoma which generally affected in infants whose age is less than 10 years. Almost 10% of congenital glaucoma causes or affected in infants, and 40% of juvenile child can get affected by the congenital glaucoma. So these are the two type of congenital glaucoma. Then acquired glaucoma also is classified into two parts. One is primary and second one is secondary glaucoma. So glaucoma is classified into two types. One is congenital and second one is acquired. Congenital also is classified into the two parts, juvenile and infants. In juvenile, generally less than 13 years person or babies can get affected by congenital glaucoma, juvenile glaucoma. Just juvenile glaucoma, generally 40% of baby who are suffering from congenital, they have juvenile congenital glaucoma. And in another one classification is infantile congenital glaucoma, where the 10 years or less than 10 years old babies affected by that infantile glaucoma. 10% of babies or child who are affected by congenital glaucoma comes under infantile glaucoma. Then the second type of glaucoma is acquired glaucoma. In that acquired glaucoma also two types are there. Acquired primary glaucoma. Second one is secondary acquired glaucoma. So by this I have finished of the type of glaucoma. Now drugs used to treat glaucoma. Drug, and I will discuss about their mechanism of action, means how they are going to treat glaucoma in one line, so you can easily understand the classification of all the drugs and their MOA. First type of drug is prostaglandin analogs. In that prostaglandin analogs, different drugs are there, like letaprost is there, then travoprost is there. So travoprost and letaprost, this type of prostaglandins analogs are used to treat in glaucoma. How they generally show their action? They generally show their action by decreasing intraocular pressure. So the first type of drugs that can be used in treating glaucoma is prostaglandin analogs. In that we can use letaprost, travoprost, etc. How they are going to show their action? They are going to show their action by decreasing the intraocular pressure of eye. The second type of drugs which can be used to treat glaucoma is beta blockers. In that beta blockers, different drugs are timolol, atenolol. These beta blockers types of drugs also can be used to treat glaucoma. How they are going to show their action? They are going to show their action by decreasing the production of aqueous humor. We know what is aqueous humor. There are two types of liquid that is present into our eyes, which generally helps in showing vision to our eyes and to maintain the pressure of our eye. So beta blockers generally show their action to treating glaucoma by decreasing the intraocular pressure, by decreasing the production of aqueous humor in our eyes, that are going to help in treating glaucoma. The third type of drugs that can be used to treat glaucoma, that are alpha agonists. So alpha agonist drugs are also can be used to treat glaucoma. In that different are there clonidine, that alpha agonists also can be used to treat glaucoma, and how they are going to show their action. They are also show their action by decreasing the production of aqueous humor, same as beta blockers, and that leads to the decreasing in intraocular pressure. So both beta blockers and alpha agonist drugs are also can be used. They can be used to treat glaucoma. They generally show their action by decreasing the intraocular pressure, by decreasing or by inhibiting the production of aqueous humor into our eye. That can also leads to the treating of glaucoma. The other types of drugs that can be used is carbonic carbonic agonist. Carbonic anhydrase inhibitors. Then also we can use cholinergic agonist drug. So these all are the classified of drugs that can be used in treating glaucoma. So what are the drugs that can be used to treat glaucoma? I have discussed now. That is, in short, I am telling now. Prostaglandin analogs, then we can use beta antagonist or beta blockers. Then we also can use alpha agonist drugs. Then we can use carbonic anhydrase inhibitors types of drugs. Then also we can use cholinergic agonist drug. So which are the drugs we can use? Prostaglandin analogs, beta antagonists or beta blockers, alpha agonists, carbonic anhydrase inhibitor, and cholinergic agonists. So these all are the drugs that is used to treat glaucoma. So by that I have finished up the today's topic that was related to glaucoma. In this class I have discussed about the definition of glaucoma, what is glaucoma, why or what are the etiology of glaucoma, what can be the symptoms or what can leads to the eye due to the eye affected by glaucoma, what are the risk factors of a person who generally can be easily affected by the glaucoma. That risk factors also we have discussed. Then we have discussed about type of glaucoma, where we have studied about two. One is congenital and second one acquired. In congenital also two type we have studied, juvenile and infantile, and in second part acquired glaucoma we have studied about two type. One is primary glaucoma and secondary glaucoma. After that classification we have studied about different types of drugs that can be used to treat glaucoma. In that famous drugs are prostaglandin analogs, beta antagonist, alpha agonist, carbonic anhydrase blocker, cholinergic agonist, etc. These are the drugs which are generally famous and generally used to treat glaucoma. So by that I have finished up the topic glaucoma in today's class. In next class I am going to discuss about myasthenia gravis. Thank you.